How do the thymus and spleen affect T cell maturation in lymphoma? Imagine your immune system as a busy city with different neighborhoods working together to keep you safe. The thymus and spleen are two vital parts of the city, each playing a unique role in how your immune cells develop and fight disease. When it comes to lymphoma, especially those involving T cells, understanding these organs helps us see how the disease starts and progresses. The thymus is like a training ground for T cells, which are crucial soldiers of your immune system. Immature T cells, called thymocytes, leave the bone marrow and migrate to the thymus. Here, they undergo a rigorous training process that helps them learn to distinguish between your body's own cells and harmful invaders. During this process, they develop into different types of T cells, such as helper T cells and cytotoxic T cells. The thymus also screens these cells to eliminate those that might attack your own tissues, a process called selection. If this process goes wrong due to genetic mutations or errors, it can lead to the development of T-cell lymphomas originating in the thymus. For example, thymic lymphoblastic lymphomas are aggressive tumors that start in this organ and can quickly spread to other parts of the body like the spleen or lymph nodes. These tumors often have markers typical of T cells, confirming their thymic origin. The spleen, on the other hand, is like a secondary checkpoint. It filters blood and supports immune responses by housing mature T cells and B cells. While it doesn't create T cells, it provides a place for these cells to reside, activate, and multiply. In cases of lymphoma, the spleen can become involved when malignant T cells or other lymphocytes spread from the thymus or lymph nodes. The spleen's environment can help these cancerous cells survive and grow, which can lead to symptoms like an enlarged spleen or blood abnormalities. However, the spleen's main role isn't in the initial development of T cells but in supporting immune responses and, unfortunately, sometimes harboring lymphoma cells. When we look at non-Hodgkin lymphoma of T cell origin, most cases involve mature T cells that have undergone abnormal changes during their development in the thymus. These changes often involve genetic mutations affecting how T cells grow and differentiate. The thymus is therefore a key site for understanding how these lymphomas start. The spleen's involvement usually indicates that the disease has spread beyond its original site, affecting how doctors diagnose and plan treatment. In summary, the thymus is essential for the birth and education of T cells, and errors here can lead to the development of T cell lymphomas. The spleen acts as a secondary site where mature T cells resided and can become involved if lymphoma develops or spreads. Recognizing these roles helps medical professionals better understand the origins and behavior of T cell lymphomas, guiding more accurate diagnoses and effective treatment strategies. Always remember, if you have concerns about lymphoma or your immune health, consulting a healthcare professional is the best step to get personalized advice and care.